Thank you very much, Madam Chairperson. The question we've been asked to address is how do we do business? How do we link agriculture, nutrition, and health? And I'm going to address this based on what is happening in Nigeria. As you know, Nigeria has a population of about a quarter of Africa, and if it will work in Nigeria, it will work any other place. Now, the FAO data on food insecurity, the 2000 report, showed a dramatic reduction in undernutrition in Nigeria. 44% in 1981, 16% in 1992, and 8% in 1998. And in spite of this kind of data, Nigeria has been far less successful in combating its high levels of malnutrition. The 2008 NDHS, Nigerian Demographic and Health Survey, revealed very, very poor nutrition situation of under 5 children in Nigeria. 41% stunting, 23% underweight, 14% wasting. And so we can conclude that meeting adequate nutrition requirements of the population is beyond food production, and we have to look elsewhere. Now, the causes of malnutrition are well known, I'm sure, to most of us in this audience, and they have been classified using the UNICEF conceptual framework into 3 broad categories: basic causes, underlying causes, and immediate causes. I want to focus on just the basic causes. The conceptual framework shows that the basic causes are crucial to the formulation, execution, and proper coordination of nutrition and health-related programs for successful outcomes. So they play a vital role in terms of policy development, and indeed, policies as guided by stakeholders, by statements made by stakeholders, are necessary for appropriate coordination of programs. Now, in Nigeria, there are several sectoral policies and programs in agriculture, in nutrition, and in health to address the problem of malnutrition. But the problem is implementation. Implementation has, however, remained uncoordinated and has remained limited in scope, and thus has not been able to achieve the desired goal. So policies on agric are devoid of information on nutrition, regarding nutrition and health. And of course, the nutrition and health policies are also devoid of, or developed by professionals indeed, contain very few elements of agriculture. So the void created by the poor integration of agric nutrition and health policies is now drawing attention from organized stakeholders. So what are we doing in Nigeria? In December 2010, the Nigerian Academy of Science brought together, probably for the first time, agriculture, nutrition, and health experts to sit in the same room and talk to each other. They were brought together to deliberate on how to leverage agriculture for improving nutrition and health. The meeting highlighted a few things. One, the need for collaboration for improved outcome. Two, the establishment of proper coordinating body. And three, involvement of crucial stakeholders. But there are challenges. challenges on thinking on how we do business. That is, how the 2 or 3 professionals can work together without subjugating each other. In other words, a situation may arise where health thinks that they should take leadership of such a thing, of such coordination, and Agric will feel that, well, we produce the food. Without food, there's no nutrition, so we should be the leaders. So there can be some kind of infighting. Another challenge is the source of funding, as was mentioned by Rosanna. Source of funding to organize the professionals from the 3 fields to develop a joint policy that will reflect the need to work together for the common good. Agriculture, as you know, as many of you are aware, agriculture has received more attention over the years through budgetary allocation. And in Nigeria, when the government presents its budget, there's huge amount of money voted for agriculture, although there are no results to show at the end of the year, because government gets involved in such things like importation of fertilizer. They have no business, but it's good business for them, but bad business for the country or for the people. At the same time, nutrition is donor-driven. Macronutrient Initiative, UNICEF, FAO, and government will fold its arm while MI will bring vitamin A capsules into Nigeria for supplementation. These are programs that government on its own can provide the funding, but they will not do it. And we thank God that we have agencies that are ready to help. Now, so what do? We must develop a joint policy document, agriculture, nutrition, and health policy document, that will provide a roadmap that will reveal how the 3 professional groups, the 3 fields, can work closely together to reduce the level of malnutrition. It will create an institutional capacity strengthening for the young professionals who are coming up. And success along this line will provide a more cost-effective means of reducing the burden of malnutrition and also improve health. Thank you very much.